affect the other part. Other relationship with the fascia. So the fascia is not only outside or inside, it's also have a relationship between layers of the fascia. So you have the epicranial connected in some way to the dura, superficial middle cervical fascia, deep fascia. So the cervical region itself has 3 layers of fascia. Can you imagine? So if somebody have a TMJ problem, may affect their typology, like the way they stand or walk or actually balance their center of gravity. Same thing here. Pleura to the pericardium. Strong attachment. The pericardium has 3 attachments. One the cervical, one the diaphragm, the diaphragmatic epicardial ligaments, and one sternopericardial ligaments. So if those ligaments has been affected, it can affect the whole system too. Okay, in order to visualize how the body works through the fascial system, we need to look at this model of Brothers Wright, the one invented the first airplane. If you look at the picture, there is no any what do you call it, routers or anything like. They decided to make the airplane goes to the left. The whole structure, they just remove the whole structure. If they need to go up, they just do that. If you look at that guy here. So our body works the same, pretty much. If you think of the, for example, the ligaments and of the pelvic area, pretty much works the same way. So we call this model the integrity model. So there is a genius guy. His name is Dr. Donald Engbert, MD, PhD from Harvard University. Came up with proof that if you affect the structure or the shape of the cell, that affects the physiology. So if we have a structure of vessels being compressed, that eventually will affect the physiology of that tissue. You can actually go to that website. So that was a great discovery. So now we know if somebody have compression or tension on some structure, that will affect the physiology. Well, in the human body, everything is in the integrity model, but the integrity model in the body is a little bit shaped, like a little bit starting from the embryology, the DNA, spiral, everything, and that gives more durability to the structure. And that's what actually fascia maintain. Well, example of relationship now, we can see patient with shoulder pain, but that shoulder pain not related to shoulder, maybe related to the C-spine, or they have a liver dysfunction. We can see patient with tibia fibular pain with relation to kidney problem, same side. Inferior scapular pain, they have nothing in the skeletal system, but they have a problem with the gallbladder. That's a referred pain could be. Many patients have a vertebral dysfunction, like we call it in the therapy spinal dysfunction, like they are rotated, or we call it like side bend rotated to one side of the body. And actually, most of those patients can come as a result of liver dysfunction, or it's related to the liver. Also, there is another relationship here between the vertebral dysfunction and the liver or GERD dysfunction is the sympathetic ganglia, which is located in front of the head of the ribs between T1 to L2. Again, leg length discrepancy affects viscera, yes, or can be as a result of visceral dysfunction. That's common in the post-hysterectomy patient. Sometimes it creates torsion in the pelvis. Headache, TMJ, anterior typology, same story. Low back pain from visceral origin. Many patients come to therapy for chronic low back pain, and we treat them forever, and they don't get better because the problem is not in their back. is somewhere else. Clinical uses of fascial release can be condition of respiratory dysfunction, structural dysfunction, spinal, cranial, pediatric, women's health, and this is what we do for them. This is an example of the global treatment. This is somebody treating shoulder, frozen shoulder through releasing the tension from the pleura. So he's working on the left lung as a cylinder and trying to move that cylinder as one piece. So that by this way he can help the patient. Same thing here, he can do fascial adduct. This is a traditional way. So many examples we can do for those patients. Suboccipital release, dural release, suboccipital, subscapular release. This is tools of the treatment. Okay, now we understand we cannot treat spine without treating or removing restriction from surrounding the spine. Okay, so benefits of global fascial treatment: restoring normal body alignment when it's possible, of course. Restore functional range of motion, joint mechanics. Decreases chronic pain to a tolerable level. Helps circulatory, lymphatic function locally and generally. Decrease the dependency on the medication. Patient education. We do a lot of patient education in order for them to maintain their progress. So the summary is understanding the global approach. The body as a unit, structure and function interrelationship, and the creator designed the inherent capacity of the healing. We all know that. Understand and appreciate the dura, the fascial element, and their role on the structural strain and total body health. Patient we can treat globally: post-traumatic patient with poor rehab outcomes, servogenic headache, chronic neck pain, non-angina chest pain, chronic shoulder dysfunction, chronic low back pain, sports injury, chronic fibromyalgia patient. So try us. I'm at Adventist Rehab Willowbrook, and this is the address. I think it's affiliated with Adventist, and this is my email just in case if you have a specific question. A doctor by name William Sutherland usually you say to the student, all I have done is to pull aside the curtain for further revision. Thank you.